Hi everyone, Ginger here. I had a question sent to me by someone on Instagram, and the question was in relationship to a squat in yoga or just any time. It just doesn't have to be yoga, right? And her concern was she had limited ankle range of motion, which would mean that it would be difficult to do what I'm doing right now. And she also had a pinching in the front of her hip. So as you may know, my name's Ginger Garner. I spend a lot of time helping mostly women, sometimes men too, through practice pain points with regards to movement, any kind of movement at all. But a lot of times it ends up being about yoga. As in, this pose doesn't fit and this pose hurts me. Why is this happening? How can I shift that? So this little series, Pose of the Week, is all about adapting poses to fit you rather than you fitting the pose. So let's tackle squat, which is a great question, and the possible hip pinching and lack of ankle range of motion. First of all, let me get rid of these and talk about why there could be pinching in the front of the hip. Well, when you get down here, you usually get to a point where the heels either lift, right, and you can't go all the way down, or when you get there, you actually feel some of that pinching. Now that's assuming that you can bend the knee all the way and there's no back issues, right? We're totally talking about just her issue, ankle problems, and the hip pinching. There could be, in the far off possibilities, like a hip labral tear. Is that my primary concern? No, not really. My primary concern is maybe that there's muscle tissue and or capsule in the front of the hip that maybe just getting, caught and pinched up. So one of the ways that I address that to help people get into a squat is using a yoga strap and angling that yoga strap towards you. Put your left foot, ball of the foot on the strap. Let's just say it's your right hip that's doing the pinching here. Okay. And you don't have to straighten this leg out. This is a short strap, and it's possible to do it with a short strap. You don't have to have a 10-foot strap, although a lot of times I'll demonstrate it with a 10-foot strap. Make sure that this is on your bottom of your foot. This is called your gas pedal. Okay, gas pedal here, knee to chest here, gas pedal that left foot down and back. So flip it around and show you. You have to relax this hip. The left hip is working, this hip is relaxed, and you just gas pedal a little, gas pedal. I want you to create length through the side of the body. So that's just kind of the yummy factor, right? You can roll it across, you can roll it back, right? But the issue is really relax the right hip and let it go. Let it be drawn downwards, okay? Downwards. Try your squat again. See if the pinch is gone, right? It might be. If it is, then it was probably a soft tissue capsule thing. The hip just needed to be moved just a tad bit backwards and downwards. And that's actually a self-mobilization. If you did have a hip labral tear, you would probably increase the pain by using this. So then we don't use that, right? You need to see your pelvic hip PT. And that's what I see every day, is people coming in with a lot of hip and pelvic pain, low back pain, SI joint pain issues. So that is a little test you can do. Be gentle with it. If you test that out, glide it down, I call that a hip release, then you should be able to get into that squat, okay? Otherwise, then it's another tier of sleuthing, right? Of detective work or Sherlocking the problem. So what about ankle range, right? Ankle range could be similar. Now, if you truly have a loss of motion and maybe there's a fusion or something like that in the ankle over time, or arthritis, then just put something on your heels, right? put something under your heels, a sandbag, a blanket, anything like that, right? We just grab what we have around the house, support the arch, and then get down here like this, right? But if you think that it might be a similar problem to the hip, where you need some, mobility, right? Just like we did with the hip joint. And just to illustrate it, I'll grab my pelvis here and show you that when the hip is in this position, we're actually drawing the hip down like that. That's all we're doing on a very kind of micro level, without pain, always without pain. In the hip, in the ankle, then you might be looking at a couple of things. Is there a lack of motion in the back of the leg, a lack of mobility through the ankle in the back of the leg? And if so, then you can roll out the two sections of the calf, the gastroc, which is where I am now, on the outside, and in the middle, coming up through the bottom of the leg, is the soleus. You can look it up and roll both of those areas. Right? And sometimes that will help increase the motion. So it's not in the ankle proper at all. It's actually in the soft tissue in the back of the leg. That can run all the way up, but that's more than we have time for in this video. But sometimes the problem is not the joint, it's the fascia and the responsiveness of the fascia and the muscle belly and the soft tissue around it. So if it is the ankle, and it's in the joint, and it's not just in the soft tissue in the back, then you'll need a yoga belt again. I want you to put it on the arch of your foot, cross it over, come around the back. The crossover has got to be right in the front of the joint. Okay, right in the front of the joint right here. See that? Can't be higher up. Strap it behind your other leg. Now get down into a running stance. Okay, see how it's on my heel? It's on my back heel, on my opposite leg, and then I've got the cross in the front. The cross goes right here where my hand would go if I was seeing you in person in physical therapy. And you'll take a runner stance and just pulse. You can just do little pulses. You can even go a little bit more bent. You can go a little bit more straight. And you're just pulling straight back. To see if then afterwards you have more range, okay? Instead of having the ankles pop up, you might actually be able to have more range and less pinching here and less pinching and tightness in the back of the leg. Okay, I hope that gets you into a better squat. No matter if you're squatting for everyday activity, or you're doing a squat for yoga, or you're doing a prayer twist, or whatever it is you're doing, hopefully that will improve hip mobility, less pinching, ankle mobility, less pinching, less pulling. Okay, until next time, squat safely. And if you're looking for more poses of the week, head to integrativelifestylemed.com or check me out, Dr. Ginger Garner on YouTube. Bye.